The picture ya Botswana says there are mood disorders, there are anxiety disorders, there are the psychotic disorders.
So I know that mental health is one of those biggest subjects. So we've got here one of the psychologists who've been practicing in Botswana for a long time. Molefi, what sticks out from your experience and your colleagues as well in the industry?
Drug abuse, drug misuse is rife. For some, they think it's recreational, but then it becomes a habit, becomes habitual, and then it becomes a problem like that. Weed is very common. It is used widely.
Really?
From 10-year-olds.
Really? There's a document from World Health Organization talking about this, that the suicide rate in the African region is the highest in the world.
It's rife. Our living conditions are a contributing factor to the way things are. The demands that are put on human beings by society or by thought also weigh heavily on people. I never heard it said to anybody, but I hear people saying, I hear, so these phrases that have been used then say to our male counterparts, aggression and violence are the way to go. If you want this, go for it.
We operate in stress as an entrepreneur. I mean, we get stress all the time, but sometimes stress puts us in flow, in a very optimal performance state. But now there is stress that's unhealthy.
Stress is vital for our lives. Because when you experience stress, it says to you something is not right. But then there are times when you live a life that has you perpetually in a state of stress. When facing stress, if you can tell yourself that this is something that I can overcome, it doesn't hit you. When you say, hey, that is when the problem becomes really big.
Welcome to the Growth Well podcast, where we tap into a well of knowledge, innovation, and leadership to fuel Africa's growth. Here, we explore thought-provoking insights and expert knowledge that empower individuals and businesses to thrive across the continent. Whether it's personal development or professional advancement, our conversations inspire action and impact. This is Growth Well, where ideas flow and growth begins. Let's dive in.
All right, welcome to Growth Well podcast. We are back, and today we will be looking at mental health. What a sobering subject. As some of you already know that Growth Well is there to bring insights for you to understand the context of what's happening in Botswana and Africa in a way that we can bring some experts who can try and unpack and explain some of these issues in a way that we can understand and hopefully participate or contribute to our personal growth. So I know that mental health is one of those biggest subjects. So we've got here one of the psychologists who've been practicing in Botswana for a long time. So be prepared for that. So, Molefi, dumelang. So welcome to Growth Well, me. Now, we usually start on a light note before we go into the deeper stuff. So I'll start before you tell me your light stuff.
Okay.
Now, in terms of now that we are talking issues of stress and anxiety and depression, I was reflecting before we come here, what have I done? Because as an entrepreneur, you get all sorts of hits from all sorts of direction over your career. And one of the things that has worked very well for me is if I've had a very hot issue in the boardroom, or I had a very difficult client, because we do have a difficult client, or even have issues within our workspace. When I come back, I drop my stuff and I go running.
Okay.
Yeah, I've been a jogger now since I graduated, I think, because even when I was at the mine in joining, I used to do a lot of jogging. But when I come back, I see it just reframes. I mean, to borrow your language as psychology, reframes the mind. I can even see, so this is how I deal with stress, because stress, she'll say more about it, it affects all of us. So that's how I deal with it. How do you deal with it? Do you go to the farm? Do you walk in nature? Do you play a guitar? So it's all in different forms. So let me turn this now to Molefi before she introduces herself, just how she deals, because I'm sure as a therapist, it must be quite a challenge. We had a rare Hambiraha. Sometimes you're looking for the police to police the police.
Yes.
Where he was giving an example of how there was a gentleman, actually quite a subject matter here, who had committed suicide, spent ages in the bush, and he had to go. And I was like, come on, I needed help. He was the first to be at site, so it was so daunting. So how do you deal with this yourself in terms of,
my stress management? It's a very easy one. I sleep and I get a lot of restoration from sleep. When I'm sleeping, it's one thing that helps me cut the world, cut myself from the world. So I sleep.
Because you're able to sleep.
I am able to sleep.
Because a lot of people struggle. Sometimes I struggle to sleep.
And at times, issues from clients will disturb my sleep patterns. And I say to myself, but what am I doing with this issue at 3 a.m.? I can't call the client at 3 a.m. I can't wake my husband up at 3 a.m. I can't call a colleague at 3 a.m. Robala Thato. And I sleep.
Really? You're able to tell yourself sleep and actually you sleep.
And I do
you
reframe.
Talk boring the word reframing.
I talk to myself. It's not voices I hear. I talk to myself and I'm able to sleep.
Because my favorite place where I'm able to sleep. And I think the problem with me personally coming to sleep is because I'm a light sleeper.
Me too.
Yes. I wake up. And then the problem is that now if you wake up at 1 a.m., I don't know how to tell myself to sleep. So my favorite place to go, which I'm always arguing with Nancy, my wife, why do you go there for longer? Whatever. It's because when I'm at the farm in the bush far away, it's quiet and it's dark and I disappear.
And disengage from the buzz of everything.
Exactly.
That helps too.
Yeah, it really helps.
I do have that experience too.
Okay.
I take weeks of my work schedule and go and work at the farm. You see, you work, you become active, your body tires.
That's correct.
With your mind doing a engaging task. It's repetitive, If you take a hoe to clear the ground, you don't need to be a rocket scientist to do that. So you're busy doing that, your body tires, you take a bath, you eat and you sleep, and the nighttime peaceful sounds, the clear skies, the stars that you see when you open your curtain or looking through the thatching roof, that's very calming. Moving away from the hustle and bustle of your everyday life does also help. I do that by sleeping.
Wonderful, wonderful. And then the Thato away from the formal work. Who's Thato? What are we going to say?
Wow.
The mother, the sister, whatever.
Thato is the sixth born child of the late Reverend Daniel Monchu, Rawa Morolong, who was a very handsome man.
You had to throw that in.
I had to. Who married a very pretty Mokhatla lady, wa Khasau Esther Dibotelo, who became Esther Monchu, who is still alive. I did say pretty as well. I have 5 siblings, 4 brothers, 1 sister. Our firstborn brother died in 2002. There are days that it hits like it happened just yesterday.
Oh,
and there are days, thank you. And there are days where I'm like, oh, Jingles, he'd be dancing to this song and I dance and it's okay. And other days are like, and then I go and sleep.
Little sister.
And in it was 2000, January 2000, should have been December 1999. I got married to Lefedile Molefi of Pilikwe. Where somebody did his Tirolos chapter.
Thank you, man. And I had great time. Pilikwe is not just fun through Chaba, but it's a very historic. I was very impressed with the history of Bidikwe. It's very rich.
And very scenic too.
Yeah, very absolutely. Absolutely.
Been married 25 years now. If I had to pick anybody to marry again, it would be him. We have 4 children. And it depends on whose friends I'm talking to. So there's Maholo Aitile for Aitile's friends. There's Mahlo Homolemo for Homolemo's friends. There's Mahlo Hone or Mahlo Mune for Mune's friends. There's Mahlo Tota for
Go with different names, yeah.
And it's 3 girls and a boy. Now these children's voices are the same. When I call, no matter whose phone it is, it's about the mama. Not mohonna.
No, I haven't said anything.
And I'd say, Kibua lemang, Mama, it's me. I know it's you, but who are you? Mama, it's me. Mona ka kibua lemang. Okay, Kimone. Oh, thank you. I thought Kitlotla. Or Mama, it's me. Kiri it's you, but who are you? Oh, I thought you were Loatile. We have nicknames. Ki Puki, Li Bumbu, Li Nei, Li Folo. So I'd say, am I speaking to Folo? No, Mama. Ki Puki. Oh, Puki, but I thought you were Bumbu. No. So, error.
Okay.
So that's me, error.
Okay, lots of brothers. We
4
went to school with them,
error.
Ghana, so I know them quite well.
Error. If I were to be spoiled, I'd call myself a very spoiled little girl in terms of how my siblings still take care of me. I have a brother who came out yo ilengkitsana ko skweleng ke tlhetsele ene a nkatametseng thata ka dingwaga. And when people talked of go tshunisiwa ga ma form 1, I got into school, Lobatsa Secondary, and it was Monadu. So I never had any of that. And then the disadvantage of that was when guys took an interest in me, Duma would be like, Lavi, ubuelema. And yet he'd be with some chick and get double standard. That's not fair.
That's wonderful. And then the professional in you, I mean, you've been in the game for quite a while now. I was calculating maybe about 25 years or so.
But I'm 25 years old.
The psychologist, the training, and then the profession. How have you traveled the journey up to now at a very high level?
When I grew up, I knew I'd be a lawyer. I remember in the very early 80s, my third-born brother, who ended up graduating as a lawyer, was reading some books of my grandfather's Remonchu. My grandfather was a teacher, and volumes of encyclopedias and di buka ka go harologana. My grandmother's brothers were doctors.
On your desk,
my grandmother's brothers on the Molema side.
Okay.
There were 2 doctors. Ngaka Sefetogi Molema le Ngaka Mudiri Molema. So
your grandmother was a Molema?
Was a Molema.
Oh, okay. Big names in there. So
I don't know how it happened that my grand uncle's books landed at his sister's house, but we would peruse them. My lawyer brother would take these dictionaries, Adibala, and there was a time where he had a debate with the oldest brother, Ka Lehoko, presiding. I can confidently say this. I can and then I said, I think presiding is one who oversees and Shara says, yes, Nak. So I grew up and yes, fast forward 1991, my brother graduates as a lawyer, and I said, ooh, it means we're going to have 2 lawyers in the family.
Yeah.
So will it be Monchu and Monchu partners, or will it be Monchu versus Monchu? I thought to myself, won't we be too much into each other's space? I don't want us to have clients Monchu versus Monchu. So I dumped following the profession of law, and I said, I had thought of being a teacher around standard 2. My mother was a teacher. My grandmothers were teachers. My grandfather was a teacher. My mother's sisters were teachers. No, my Rakhadi was a nurse. My cousins, Balibansi, an influx of teachers. So I thought of law. My brother graduates as a lawyer. Monchu and Monchu partners. Monchu versus Monchu. And then I thought, I've always known that social work. And the way we understood Mabuipelo was that Mabuipelo go to some with food baskets.
Oh.
That was my little understanding. But is that all I can do? Then from 5, Kiapasa, Girang, Mami then talks to somebody who worked at student placement. That's what it used to be called, bursaries. Meyontara, when I listen to the psychology, so by that time I was a teacher for English and agriculture and domestic science, 3 in 1. And I read a column that said psychology was the study of human behavior, also human cognition, thoughts, and the emotions. And we help people with those. Sounds interesting. At least I'll be dealing with people, not only giving them food baskets. So I then go back to bursaries and say, I think the little that I've read is interesting. I applied to one university in the US while simultaneously having applied for social work at the University of Botswana, having gone for the interview. And I believe I was admitted during that interview for
at UB as well.
For social work. And then as I was supposed to sign the memorandum of understanding with bursaries for UB, a fellow who worked for student placement, Naira Tirol Shabateng, one day is Tigel, Bako States, yo. So I didn't even attend to the MOU, UB. I signed up for the US, and before long,
But still under government scholarship.
Still under government scholarship.
They just switched it to. Okay.
It wasn't even switching because I hadn't agreed to anything with.
Not contracted yet.
Remember, I'm a lawyer in training.
Shadowing your brother as well.
Yes. So I got to the US. Psych 101. Okay. And we did anthropology, did sociology, and French. What has French got to do with anything?
Behavioral science.
Me, when I can tusanyana ka gore ke ne ka ithuta bo je m'appelle Thato je parle français. That's all I can say.
Whatever you're saying.
And it became interesting. Semester 2, I was like, I'm loving this. So I did my first 4 years undergrad psychology.
This is University of?
Virginia Commonwealth University in Richmond, Virginia.
Okay.
Florida
was the master's.
Okay. So Haikiliko VCU, I also did a minor in history. So I then graduated and came back home looking for jobs. I tried my luck with DCEC and they're like,
Directorate of Corruption and Crime. Yeah.
This was 1999.
Okay.
And then I applied to the Ministry of Health. I was hired as clinical psychology 2. Posting Francistown. Nikita Mpira go Sabrana Hospital at that time it was the Lobasa Mental Hospital. Nikita Mpira go Lobasa Mental Hospital Gabley Gileke in 3 months ago. Nyami, there's already a psychologist establishment register. Isupa hore the post is taken. Okay, ke kopa go a Marina. Marina ke mo Gaborone, I have a sister ka nna le ene ke ka commuter ke tswa ko lapeng ko Lobatse nya post ko Francistown mogala makapa. Heaven. So I gathered my little bag.
Went to Francistown.
Went to Francistown. First 2 weeks stayed with a brother who was my brother's friend. But I had to. And then I spoke to my uncle, my cousin. Tata, he's my uncle, but we called him cousin because of the age gap between him and our mothers, who was the then MP of the area on Tara. Come live with me. I live with the people. So in my mind, I'm thinking, Pakalani wa Francistown, people na kongwe. He was there. Abare, la weekend na he says, yeah, these are the people.
These are the people.
I'm like, I will. However, from here to the bus rank, and then from the bus rank, go Jubilee Psychiatric Hospital. And in this process, Molefi abana very serious back then it was government policy for married. Was it government policy? They allowed for married people should get housing, not sharing. So kabona ko ke khona go bona ntlo ya puso ke nna ko Selepa and ke berekela ko Jubilee Psychiatric Hospital. Thing as a wet behind the ears psychology graduate, not psychologist. I mostly did translation work for Dingaka psychiatrists Babanemba Sabuye Setswana.
Okay.
We had Kenyans, Ugandans, Zambians, Zimbabweans. So ke ne ke tla be ke le ho ke tolokolela batsadi le era. And kakiso e potlanene ke nana yo ya psychology would have a few sessions tse ke tla reng di laitenyana bo ga ke khone go bala ko lapeng bang kgerisa, you know, tse ke neng ke re di laite. And then September, so I was hired August 5th, 1999. And then August of 2000, got a scholarship through government to go and pursue my master's. This time it was in Florida in clinical psychology. So I had worked a little over a year. I would guess schooling. Because Kwelesi Buse September 3rd of 2000, Nike Hirlwe August of 99. I would guess schooling for a 2-year master's program that I was supposed to complete within 2 years. Program there was a lot of theory where we learned theories of psychology and mental health, and it taught us interventions as well. But it didn't allow us a chance to go on internship to learn under the guidance of our teachers how to implement these. So the lady I was with, ke kopa ngwaga o le one gore ke khone go ira internship. They allowed for that
in the States. Still.
In the States era. I am forever grateful for that. So I did a 2-year master's program in 3 years.
Okay.
Ha re santse re le ho nkgonna ba lwala thata a bo Ramasedi a mogapa a bo ke sa pase sentle. Ke sa paseng sentle. There was also a course that I found very irrelevant to me as a Botswana because I was saying the responses in that assessment tool di ne di bua ka bo a space shuttle taking off. Di bua ka the last card on those was an underwater scene.
Okay.
Where
this is still part of your master's.
Era. Where gona le di seahorse, gona le jellyfish, gona le, and I was saying ke gore motho a sa jogare a tshwana le nna o itsetse kae space shuttle. O itsetse kae seahorse. A ke pitsi pirige e tabaga mo metsing kana jang. So I didn't invest in that course. I didn't like it and I flunked it. I was supposed to have gotten 90% gore ke khone go hitela to the next year. I became 84% ka 6 yo lo tswa ka he banna. So I failed ka 84%. I didn't fail ka 48%. So I had to repeat, meaning ke tla ngwaga o mongwe o simologa era. So my 2 years
so that we're up to now. Quickly, and your Harvard experience.
So my 2-year program that became a 3-year program actually became a 4-year program. So I have 8 years training as a clinical psychologist. But then I say, doctors for their first degree take 8 years. So so came home, worked Gonyanga, came to Marina, established the psychology department, go Princess Marina Hospital. And then 2010, I joined Botswana Harvard Partnership as a clinical psychologist, master trainer, specifically for the adolescent program, where we trained nurses and...
so you capacitated the hospitals across the country.
And we'd visit to monitor, to mentor. And then I went into private practice end of 2014. Me, Jovial Inspiration Psychological Services was conceptualized in 2007.
Much earlier.
So 7 years later, there's something about 7 years. 7 years later, I went into private practice.
And what do you do at your private practice, in summary?
In summary, as a clinical psychologist, I offer therapy to people who come with an array of disorders, mental disorders, the spectrum of mood disorders, depression, regular depression. Depression in a makamunyana ke tla ibisa jalo gona le dysthymia, which is a long-standing depression, gona le bipolar depression where the person exhibits symptoms of elation, mania, and then depression.
Sort of,
gona le adjustment disorders that have depressive features. When you've undergone a life-changing experience, you may develop depressive symptoms. And then there's the anxiety spectrum, leone inzi thata, le workplace issues, GBV issues. And in my clinic, because I wasn't trained to work with children, I do not work with children. If in 700 years there's no one to attend to this child, then I'll do it. Because but I haven't practiced it.
Yes, you haven't practiced as a practitioner.
So it's teenagers to end of life.
Yes.
So it's 13-year-olds to 90-year-olds.
Wonderful. Now coming to the topic of the day. And we did discuss earlier, this is, we are all affected by this mental health issue. It's like during the days of the HIV/AIDS pandemic where, we are talking about, affected and impacted. I think mental health is the same thing. So I'm hoping that with our viewers, everybody can reflect after, your insights in terms of even, I was telling you earlier about we don't know much about mental health. You don't even know when you're in the space. Yes. After I learned so much, I even reflected as a, enthusiastic entrepreneur, businessman in the 30s. And I said, there were many times when I was actually in stress.
That's right.
But the most important thing, Thato Kohore, the world seems to be burning with this mental health issue. At Africa level, Botswana is no exception. The issues of violence, GBV, we seem to be stumbling over it and struggling over it. And I just wanted to ask you just a simple question. I mean, the statistics are very scary. You know that last year, even an elderly man of over 70 committed suicide. Same thing I heard that there was a young boy of 12 years old in one of the villages who also committed suicide. So it's even now across ages, across sexes as well. So what's going on, me?
A lot is going on. People use the phrase "batho ba imetswe, re imetswe." A myriad of reasons and a myriad of contributing factors, depending, would it be by gender, would it be by age group? But, every individual gets to experience a form of stressor along their lives. And depending on how you perceive that stress, whether you perceive it as a stressor is one thing. And once you have said, this thing is very stressful to me, how do I deal with it? If I do not have the resources to deal with it in a healthy manner, I will then deal with it the way I know best, which we would then say is unhealthy practices of dealing with stress. Many people have said, when I'm stressed, I will have a glass of wine. When I'm stressed, I'll have a shot, or is it a tot, of whiskey. I'm naturally high. So, and those we say are unhealthy coping mechanisms. I know what a glass of wine a day keeps the doctor away. Maybe it does. Me how we nwela horitibatsa makoa. You are only sedating it. You're not killing it. It will wake up and it will still stare you in the face. And when you say, I can't deal with this the best way I know how, then going for the rope or going for the carbon monoxide or going for whatever way of killing oneself. Because at that point of thinking of committing suicide and actually doing it, I believe, because we've never interviewed anybody who has successfully done it, I believe the person is saying there's absolutely nothing anybody can do. And this step that I'm taking is the best that I can do right now.
It's a solution to them.
It is a solution. And those that the surviving family say,
and that's the typical response, isn't it? Yes. Did he or she leave a note? Let's see what the note says.
And after you've read the note, what? Where are we as family? Not that I am putting the responsibility on family, but maybe I am. When last did I check on my cousin? Okay, how are you doing? I'm fine. No, I'm asking, how are you doing? Hey, let's talk. I have done that a few times. Maybe it's because I'm a practitioner, but we don't often check on people for the sake of checking on them to try and help if we can, even by lending a listening ear.
We don't do enough of that. But it's is that it? I'm saying is that it because it's been labeled as an epidemic globally in terms of general mental health, stress, use of substance and drugs, and opioids, disaster in the States. I went through a documentary on that, which is total disaster, especially in the middle class, upper middle class type spaces. And what is odd is that the world has gotten better. People are more beautiful. I mean, you look beautiful. People are more beautiful. There's abundance of food. There's clean water. We go to movies. We got internet. And compared to, a couple of decades ago, the United States right now, they say the economic benefits has gone up by almost 3 times since the 50s. But people there are getting sadder. So how do we reconcile that in terms of modernization and also the depressive epidemic that's happening? 700,000 people that commit suicide globally every year. That's the extent of the problem.
Of the documented.
The documented, yes, absolutely. Absolutely.
You see, all these frills are external. So we'll have the movie theaters, we'll have the clean beaches, we'll have the... How about inwardly?
Yeah, the beautiful Gaborone with the, Dubai's, everything looks...
It looks
aesthetics.
Very true, which do not talk to the inward, to the internal, that do not talk to a person's psyche. I've said this issue of mental health, when there's an absence of mental health, all other areas of life, all other areas of health are adversely affected because it is the mind that makes you do the things that you do. It is the mind that makes you not do the things that you don't do. So when the mind is unwell, you can expect that all facets of life will be affected. When you have a conflict in the home, you leave the home, you go to the office. When you get to the office, you slam the door. Poor secretary doesn't know what is happening. Your supervisor, you shout at your supervisor because there is conflict at home that you haven't been able to resolve. So that social part of your life that hasn't been dealt with spews onto other areas of life. Maybe it's a question of finances that the family may not have been able to handle properly, and that also affects the relations in the family, and then it has a ripple effect on everything else. So when there is no internal happiness, internal stability, you can expect that whatever is external counts for nothing. That is why we'll be surprised that so many good things going on, so many beautiful things happening. Why are people the way they are? It's because the internal mechanisms are not quite there.
Churches are opening up everywhere, modern churches. People are singing very nicely. And
then we want to say, what for? Because now I'm going to sound like an atheist, which I'm not.
Which you
definitely not.
Let's hear it.
You see, we mask. We put on the nice shade of lipstick and go, hiding a bruise on my lip. Why am I hiding it? Why am I not letting it be seen so that somebody can say, and I say, let's sit down and talk about this issue and resolve it. We are very superficial. We don't go deep down, such that when we go to churches, the spirit that we take there is not the spirit of is often not the spirit of I want my soul to be a better soul, but it's what can I get from here? I'm going to church so that they can pray for me so that I get a job. After you've gotten a job, so if we were to look at transforming the spirit, transforming the soul, transforming the mental makeup of the person, the churches would really benefit people. Some maybe go to church once a week. What happens the other 6 days of the week? What happens to the other many hours of the week when you are not at church? So it also acts as a bandage that has not dealt with the sore that's on the skin.
Now let's come home a little bit. Come home meaning our mother continent, Africa and Botswana. We were discussing before we started the thing that the statistics that really shocked me was that some African countries top the list in terms of suicide hotspots, so to say, and Botswana being amongst them. I mean, they say average globally, it's about 11.2 people per 100,000 per annum that Botswana was 18 per 100,000 and so forth and so forth. I mean, we mentioned Lesotho, Eswatini, South Africa. And what's also, I'm trying to put together all the statistics. It also aligns to top rape countries where the levels of rape are very high. These are the same countries.
Yes.
And then, as you know, the past few weeks, there's been a whole cry about GBV. And what I wanted to clarify is that can we relate a country or a society going violent to also mental? Is there a direct correlation? And in addition to that, is there anything peculiar? I know we debated about statistics earlier. Is there anything particular about Southern Africa being the hotbed of suicides in the world? I mean, this is a document from World Health Organization talking about this, that the suicide rate in the African region is the highest in the world. I mean, this is documented.
I did say earlier that unfortunately nobody has successfully interviewed anybody who's committed suicide.
That's true.
May you would learn or doing a posthumous interview with the family, you would then pick that there were issues of mental illness. It's rife. Our living conditions are a contributing factor to the way things are. Our relations are, or lack of relations, healthy relations, are a contributing factor to these. The demands that are put on human beings by society or by thought also weigh heavily on people. So when people do not have the ammunition to properly, healthily deal with these, they go back to an instinctual survival mode. Fight or flight, I'm going to fight. If I can't get what I want, am I going to run away or am I going to fight it? Some will fight it, and fighting is aggression, it's violence, hence what we are exposed to now. And I never heard it said to anybody, but I hear people saying, I hear, so these phrases that have been used then say to our male counterparts, aggression and violence are the way to go. If you want this, go for it. I'm like, but you want somebody to be nice to you and then you are twisting the arm, but we are wringing the arm. Why do that? And it was said that as soon as she goes, ow, it's her saying, yes. So people would do that. Like I said, never happened to me.
And please, guys, don't copy that stuff. This is ancient stuff.
So things like that. There's also the question of the matter of corporal punishment in our homes. Why do we met corporal punishment on children? Does it undo what they did?
Does it still happen? I mean, you are saying it like, you are assuming that I know that it happens.
Not so often. Well, with me, I'll take my shoe and go, papa. That's the way I do it. And I would have said, look, you did not feed the dog when you were supposed to have fed the dog. It's the third day that the dog hasn't eaten. I've asked you 17 times, papa, and gives it all that food.
But isn't that violence? Papa, wawa, tuba. I mean, we grew up under the stick.
Yes.
Some of us.
Era.
Relebadisa, even being children of teachers, in the 80s and 70s. Nerokotero.
Spare the rod and spoil the child.
Mm-hmm.
Now, when it is supposed to be curative, when it is supposed to guide, that is when you can comfortably take a slipper,
Spankanyana or something. More spanking
than killing. But then when that happens repeatedly, this son of mine then says, Mama spanks me when she needs me to feed the dog. He grows up, meets a Maseho. Maseho Wankana, I'm going to beat her so that Antumel.
Because that's an instrument of trying to get something.
Era. And Maseho wa mudumela go le khantele, they get married. Maseho ga apa, ke ngwe sa apa ke batla dijo pha. Era. So it teaches violence while trying to teach to be on the straight and narrow. It's a 50-50 thing. It's a paradox that has to be solved in a way that helps guide. Yeah, but
it's a contributing factor. Are you saying the entrenched practice of corporal punishment, especially extreme ends, even from our ancestral type, contributes to the current mode of having developed a violent society?
Having not done the research, I'm going to put my neck on the block and say yes.
And you know why I have a problem with it? I have a problem with it because just global research, not just Botswana, people were more, even the days of corporal punishment, even the days when, Mosari Nyanyalwa for economic reasons, not for la-vie-da-vie. There's a whole thing about, the romanticism industry that kicked in the 18th century. Now it's going to be lively. But beforehand, it was, the role of the women was there, the men had a role and that type of thing. So but interestingly, the research shows that the mental health issues with modernization have gotten worse. But this is the era where corporal punishment is illegal. Even capitally, punishment. I mean, you know that there's even an argument in Botswana that we should drop the death penalty because that's a society that says there's an element of justifying violence by entities like governments. So that's where I struggle. When there's a guy, he's this French guy who's a social scientist in 1899. He wrote a book called Suicide. And in that book, he talked about how he's being French. So Paris was getting industrialized. People were moving from agrarian to the modern city. And he was saying, it's interesting. The richest people, even the richest countries like the UK and Netherlands at the time, the most educated, the levels of suicide were even more within advanced peoples. There are more suicides within the Protestant compared to the Catholics. I don't know, they think the Catholics were poorer than the Protestant, but that's another issue. So that's what we're not getting into. But there's something insidious about modernization when we are talking about, no beating up of kids, no beating up of couples, clean. But still, the epidemic carries on.
And in modernization, in industrialization, what happens to the social relations?
Yes. Talk to me.
I'll give myself an example. I'd leave home at around 6:40 a.m. To drop children off at school and then go to work. Start work at 7:30. Wouldn't go home for lunch because of the bumper-to-bumper traffic, which would mean I'd be late. And then I'd leave the office after 5 just so that traffic has lessened. I get home at around 6. When have I spent time with the children? When have they spent time with you? When have I spent time with my husband, who, when we get home, he goes into doing the homeworks. I love him for that, among other things. And I go into the kitchen to prepare the dinner.
For everybody.
And then we are tired.
Yes.
Ho tlhaetswe.
Lepella mo malaong yaanong.
Yeah, bo tlhaelela ruri jaanong, you know what I'm saying?
We diballa ruri.
So
yeah.
The
even the funky things of life, you can't even visit those because of the tides. Yes. Which are important for mental health.
Exactly. When done right. So that social fiber of families, of society, because of this industrialization, am I blaming industrialization? It's a contributing factor. When families don't live together, we get to not understand each other, such that even when the time that we get together, Christmas time, families do get together. I bet in every village, there's someone who can say, with this just ended festive season, there's someone who can say, my aunt, my cousin, my nkuku irked me somehow. Because we don't live together.
Yeah.
And that one time that we get together, because we are not familiar with each other, we don't know how to relate.
That's correct.
Yes.
Hence the conflicts kicks in. That's so important, because I wrote a piece on social media about how the festive season families come together, the beauty of it,
Supposedly.
Where you check in your grandma, you spend days, you cook for them for the first time, cousins, people pose for pictures. Why does this have to happen only after 12
Once
months?
a year.
Exactly. Because interesting, talking about the past, that used to be normal on daily basis 100 years ago in our villages. So in terms of the social connectedness, the solidarity, the community, I think there I'll agree with you that that's something that, and interestingly for me, that's where the Africans actually still have a little bit of that compared to Western cultures. We're still closer. We still, people, I still relate with my litlogolo, my cousins, where else, in the West, people don't even know where their cousins are, or even their brothers and sisters. So there's this falling apart of the family.
Don't even go there. Your apartment neighbor.
Yes.
You open the door, same time with your neighbor. There isn't even a nod to acknowledge the presence of this person. You go into your apartment, I get out of my apartment, and that's it. Something that I should not omit to talk about in mental health is that mental health is also a biological phenomenon. There's the brain and the hormones. That
I was actually going to come to that to say, can you explain, you now define for us what is mental health from a biological perspective, from the, like you say, the hormones, the amygdala and the prefrontal cortex, all the fancy stuff that you guys talk about.
So here's our neurologist. So the brain has various areas and functions, and there are also hormones, chemicals, neurotransmitters that affect behavior, that affect mood, that affect thinking. So the various areas of the brains, when affected either by drugs or by trauma, and trauma I mean being hit by an object, not trauma. Hey, guess what a trauma is? Will affect how a person behaves. We know that the brain is responsible for bodily functions. Now, I should have reminded myself this, but yes, the brain is responsible for bodily functions, is responsible for our behavior, such that even with me doing this with my hands, is because the brain has linked to the hand to say, point ka letsogo la moja. Behavior lo and hela the brain area is responsible for behavior, together with neurotransmitters and chemicals. There's a neurotransmitter that is heavily responsible for depression. It's called serotonin.
Serotonin.
Yeah. Jano, when its levels are low, that is when a person is in a depressive state, experiencing a disorder of depression. Then there will be tablets, medication, that a psychiatrist or a medical practitioner will prescribe to say when you take these, they'll help you up the serotonin levels so that you come to
some level of normality, functionality.
Functionality. Yes, and then
like Prozac.
There's
Is
Prozac,
it one of them?
Let's
promote that.
Let's promote
it. Yes.
Diteng and
Okay.
Many companies didira across the world. Prozac was very big in the US. Honalebo amitriptyline, honalebo diazepam.
Okay.
Thata tse di nang le bo phemo ke tsa depression. Honale mehuta 3 classes of antidepressants which would target the neurotransmitters differently. Gore motho a nne botoka. Jaanong, when these neurotransmitters are out of whack, are out of balance, that is when we get to experience these mental illnesses.
Okay.
Like that.
Okay. Carry on? You want to carry on?
Le go anxiety. Hona le dopamine. E leng gore when its levels go out of whack, we experience anxiety, we experience panic attacks, we experience the spectrum of anxiety disorders.
Okay. I wanted to, there are other hormones that I hope we can touch on them because they are related to this. Like, I think it's oxytocin, which is on the love and warmth side of things, as a hormone which helps in mental health. And then I think maybe...
And child delivery too.
Child delivery, is it? I didn't know that.
Well,
nice.
you've never delivered a child, I hope.
But I tell you, never know. Don't worry, Trump is here. And yes, and then also, I talk a lot about people having to take cold showers in the morning because it's simple, it's cheap, and it puts you on the right mood in terms of your dopamine. But also, I've learned that it also strikes a whole constellation of immune cells, like neutrophils and lymphocytes, which improves your level of immunity. Basically, and the hormone there is endorphins, isn't it? Endorphin. So those a combination of things, they have to work in tandem. Like once it's depleted, then you go into depression and so forth. Am I right? That they're
very
related.
Right.
Yeah.
You should have done this podcast by yourself.
But why I wanted you to, because people will be interested, what actually happens when I get hit by stress? Because stress, we operate in stress as an entrepreneur. I mean, we get stress all the time. But sometimes stress puts us in flow. In a very optimal performance state. As this guy Chisholm highly talks about flow, where the challenge, stress, and your skill comes together, then you get into flow. But now there is stress that's unhealthy.
Yes.
And I wanted you to relate to what actually happens in the body system, like when you see a lion and you get into fight or flight, what actually happens there in terms of, so that people can know because people in this podcast are very inquisitive about what happens under, because then that's when you bring solutions. It's very clear.
This flight or fight, flight, hoha, run away, take cover, fight, engage, obliterate, hopefully successfully. There's an equilibrium that should be struck. I hope I'm not tampering with the mic. That should be struck. So when a person encounters stress, let me see. I want to give an example. Heavy traffic. When some people are in heavy traffic, they get to be very anxious. I need to get home quickly. This traffic is too much. I'm feeling crowded. And then there's Thato who says, it will move. Because I say, I cannot afford to stress about something that I cannot manage. Oftentimes when people get into stressful encounters, it's because their mental resources have said to them, I can't handle this. I can't cope with this. And then there's a helplessness that ensues.
Yes.
And this helplessness makes you weak. As you get weak mentally, you talked earlier about your immunity. Your immunity also gets affected. This is why after dintsho tse eleng gore ke nna o ke neng ke di goga ko pele, ke ira sengwe le sengwe making sure that the coffin is bought, kgomo e teng, bagolo ba apetswe, ditee di a noa, lebitla le epilwe, go duetswe go insurance, merapelo, everything, ke organize baruti, all that, and I'm just on autopilot. Tuesday, I am flat down sick. Because at that time, I am not concentrating on this is a potential stressor. And then when the show is over, my system that says and I crash. And a thing that happens for many people is an episode of flu. Why flu? I don't know what happens to the respiratory system in that space.
But the immune system will have been, because when your immune system flu is a typical
error. So when facing stress, if you can tell yourself that this is something that I can overcome, it doesn't hit you. When you say, hey, that is when the problem becomes really big, because you are even shutting your thinking processes of how can I do this? When a person is in a car accident or about to get into a car accident, the driver, and he manages to maneuver the vehicle such that he doesn't crush this donkey, doesn't hit that cow, and does not hit the oncoming car. It happens automatically. But it's the brain being on overdrive that I have to get this person to safety. After that car has passed, and you look back in your mirror, that's when your heart starts going, and you're like, how did I do that?
I felt that, yeah. That near miss, when you see your heart and things happening in your body, that's why I was, what the hell is going on? And
it happens, you become aware of it after the fact, because at that time you are in the I'm fighting.
Yeah.
But you're not thinking that I'm fighting.
Yes, your amygdala is the one that's acting up now. Yeah.
It's just taking control. But then if you're to give thought, hello, but when you are in the mode you're getting to safety, you are able to do that.
Okay. And then I've picked somewhere where they say, there's nothing wrong with that. Like you said, then you survive the incident because your flight got into mode. But then there is an aspect of modern life where instead of that acute incident that happens and hopefully you survive, these days now it's a chronic, where now even your social media becomes regular stressor, because if you're not getting the likes, you're getting worked up. And then that's what brings unhealthy and continuous stress that brings blood pressure and all sorts of diseases. Is that correct?
It's correct. Let me also say, stress is vital for our lives. Because when you experience stress, it says to you, something is not right. Let me check it out. Let me work on it and correct it as best as I can. But then there are times when you live a life that has you perpetually in a state of stress, where physiologically then we have the constipation or the diarrhea. We have the amenorrhea, absence of menses in those who are in that age group.
Absence of?
Menses.
Keep elucidating.
Menstruation.
Okay, I got
absence of menstruation, not due to pregnancy.
Okay.
Or heavy menses.
Okay.
There is skin outbreaks, acne, pimples, because the immunity has just been messed up. And constant headaches. My shoulders are tense, my back is aching.
Even your back is affected.
Libido, the word
collapses,
ceases to exist for both men and women. And if they were to try, it's just going to be a futile attempt that does not bring the pleasure that it's supposed to bring.
Which could even lead to more conflict and more stress.
Exactly. Yeah,
so
as this happens, the stress does not become resolved because each thing becomes a stressor on top of one another. It compounds, it becomes even compacted, and it's hard to penetrate because it's so thick. And then the person gets to a point of, there's nothing I can do, Gail.
This is where the depression is at, where now you are getting into really low mode. Okay. There's another aspect that now that I think hopefully for the viewer we've explained the biological process that happens when you get his stress, and there's the good stress and there's bad stress. Even more so when it's chronic, that is going to lead you to disease or. Now, let me
interject and say, stress is good because it helps you get up and do something. It's not only bad things that are stressful. A beautiful thing of childbirth can be very stressful to the expecting mother, can be very stressful to the partner, can be very stressful to the siblings. Because, hey, my sleep is going to be interrupted. Hey, the birthing process is going to be stressful. When I am on maternity leave, I don't get my full salary. So I'm going to have to be in confinement for just 3 weeks and then go back to work. Yada, yada, yada. So a thing as beautiful as an addition to the family. Planning for a wedding. Hey,
beautiful thing.
It's beautiful. You know, the practice for the stapa dancing, and then the speaker doesn't work. When the music is not there. The choreographer doesn't turn up, or the choreographer is rough. The tailor doesn't do it right. The baker doesn't do it right. And yet we know that wedding celebrations are nice things. Or the malume wa angala, malume wa angala, khabarekelang kukuchale. It is a beautiful thing, but then it brings stresses. Getting a job, it's beautiful. Many people
celebrate,
hey, I'm getting a new job. But hey, do you know the people you're going to be working with? It's a different set of people. You're going to have to learn the culture of that institution. You're going to have to learn the culture of the people. You're going to have to adjust and adapt. Are you ready for that? So stress, beautiful things are also stressful.
I wanted for us to, which takes us back a little bit, but I think it's important when you mentioned that we've lost our communal healthy relationships, which I think inherently is something that we've inherited, and it's busy fading away. And I read one expert, this guy from Harvard who was asked in terms of well-being and happiness of people, what would be the top thing that he will say? And he says, good social connections. People should know who to call when they are in trouble. And the statistics are horrible. They say globally right now, there are 330 million people who, when asked about their social, they said in 2 weeks they haven't called anybody. This is shocking. And I just wanted to, when you're talking about lenyalo, leloso, we had that traditional thing of and then lengwana ha tsholwa because of the stress. That thing, bo mawane, bo memogolo batla. These are things that first I see that the owners, like the young wedded, who they resist. Exactly. So I made any comments around that, because that's where, for me, these are practical examples where we are losing something that actually the West will say, oh, you have. I've had it with my relatives who are outside the country, where they said, oh, okay, so people come and help you with the baby for a few months. Yes. It's like, wow. But we think now it's fashionable to do away with that. Say.
I think it's lack of understanding of why it was done, what it's done for. You know, this is where the new mother absolutely does nothing but baths herself and will eat and feed the baby. The mother-in-law or the mother will bathe the baby, keep the baby when the mother is resting. This is simply so that this woman has support to be able to recuperate properly. There is a depression that is called postpartum depression, a depression that comes after delivery.
Okay.
And it happens, among other things, the neurotransmitters imbalancing thereof, but also the pressure that is on this new mother. Hey, there's this little thing that I have to protect with my all, this little thing that I have to make sure is fit and healthy, should never cry, should immediately change the nappy, So the pressure on the new mother is heavy. But when there is someone to help in that confinement period, the stress is lessened. There will also be postpartum psychosis where the new mother,
that's where the psychoticness comes from.
Because there's the pressure of, and I sometimes inflict is a wrong word, self-imposed, let me put it mildly. I hope people understand when I say it's self-imposed, because you say, I am the mother. I birthed this baby. This baby has to be healthy with my care. This baby should not lose weight because I'd be irresponsible if the baby loses weight. This baby should not have diarrhea because it means I'll not have washed the bottles properly. I would have not fed the baby properly. And so all that pressure that is on you disturbs your thinking processes, destabilizes your mood, and then we have these disorders.
Wow. So hence that protective family members being busy in the home.
Yes.
Why that structure is very important. We'll talk later about when we try to come up with solutions from policy level, from now personal level, because these things, I don't see any intervention or process that says how do we look after this, or how do we resuscitate them? However way, I'm sure it's not easy. Just the other question that I wanted to put before you is, I just wanted you to give a picture to us of the typical cases you get. I'm sure you get quite a variety, which the experiences and the depth of the problem just from the work that you do on a weekly basis. This is actually what's troubling Botswana, whether it's the young people, even the demographic of it all, or where is it? I know there's a whole thing about, the boy child. After we talked about the girl child, now we've forgotten about the boy child, those type of things. Can you just share with us this 20-year journey and what are you seeing?
I will definitely, obviously, not mention names.
No, absolutely.
Of course.
Absolutely. Oh, yeah. We'll stop the podcast right away because I'm also trying to be professional.
And this is to assure viewers that a psychologist will not disclose names. And hoping it builds confidence in viewers to access these services that are so crucial.
Including yours.
Oh, yes, please. In my office, I do not... Not that I do not. I do not have clients coming in who have chronic, typical disorders. When people come in for consultation, when there are cases of depression, it's depressions of early onset. It's early onset as in within the year, even though the diagnostic criteria for depression is these symptoms need to have been there for a period of 2 weeks, 14 days.
Okay.
But then people will come in within 6 months to say, I've been feeling like this.
Yeah.
So when it started, how was it? That's how I can
then you can
say,
see what it is. Because we do tend to stay away thinking we'll get on top of it. Then it just...
I'm just said, but then not the chronic. But when it bridges on being chronic, I have psychiatrists with whom I work closely. Then I'll refer to the psychiatrist for the for the pharmacotherapy.
And pharmacotherapy. I know you guys like throwing fancy stuff, right? But I get it.
Thank you.
Comes from pharmacology and pharmacy.
Yes, sir.
Melemo.
But I can say the podcast. Thank you, Mecha. It is crucial, critical, very important, vital that when you undergo psychotherapy, if you are on medication, you do those together. Mm-hmm. I give examples of you have food, a plate of pap and meat. Mm-hmm. When you eat your pap alone, it's filling. When you eat your meat alone, it's filling. When you eat the two together, you have your carbohydrate and your starch and the sugars from the palichi. And then from the meat, you have the protein, you have the exercising of your jaws due to the chewing, and then it becomes delicious. But on its own, it's food, yes, but does it give you the right nutritional value? No. Likewise with visiting a engaging with a psychiatrist and a psychologist, you need to do them together because the medication works on the chemicals in your system. Mm-hmm. The medication does nothing to your behavior, does nothing to your thoughts. Mm-hmm. So,
I'm getting educated.
Thank you.
Yeah.
So when you take your antidepressants, they stabilize your chemicals. But if you have thoughts of, the pills cannot say to you, how re ga ona mosola o raja. Ga nke ke dira sepe ao. Ga wa tla tleliniking gompieno ke tsile. Ga wa phakela o tlhapile ke tlhapile ao. A mme ha o tlhapile ga se go supa gore o na le mosola. Oh, ke a bona. Medication does not do that for you. Ke ikutlwa ke tenegile mo go maso a itse o tennwe keng. Batho ba le ga ba mpuisa sentle ba ne ba go raya ba reng. Okay. Go na le gore o tenya go ka dira jang. Ke batla go di ba bolella. Wa go di ba bolella gore ke go ba raya ke re okay. But then if you have to say to them, abuti kana ga ba mpuisa sentle ga ke rata, how would that be? Ba ka ntloela. How would that be? Okay, do you think you might want to try that? Medication will not do that for you. So it's highly recommended that you do the two together.
But where is the first knock? Is the first knock with the psychologist, or it doesn't matter? How do you, I feel like, this is now going into depression. I've been sad for 3 weeks. I don't know what's going on. I'm struggling to wake up. My sleep is not working. I'm moody. It's like, this is not the way I want people know. Mm-hmm. Do I start with you or do I start with the psychiatrist?
I think it depends.
Okay.
There'll be times when there is, and this is not a psychological term, there'll be a flare-up of the symptoms that no amount of talking can do anything to. Mm-hmm. So it would be helpful to take a tablet that will stabilize the mood, rather the chemicals, so that the person can calm down. And then you can engage with them.
Okay.
And then there are times where the first move would be to consult a psychologist who would then help you unlearn these behaviors, these faulty thought patterns, such that at times it's not even necessary to go to the psychiatrist.
Okay.
So it's either or. My fear, am I guarding my profession? Yes, I am, and justifiably so. My fear is that when we consult many doctors, the inclination is to give a prescription, which is that training I appreciate. But at times, at that point, a prescription is not necessary. And then with these psychotropic medications, it's unlike a paracetamol tablet where you take, you swallow it, you take a nap, and then when you wake up, your pain has subsided. With these, you need to take them over a period of time for them to be effective and to have a lasting effect. So when you start someone on a course of antidepressants, you can expect that it can take about 3 months for them to feel,
You've talked about depression.
Error.
Now, people come with all sorts of, I don't know whether there are symptoms or actually that's what's causing. We talked earlier about sleep disorder. We've talked about anxiety. There's depression. There's work-based stress. There's suicide thoughts. There's going into drugs. I don't know if they still come to you as well, where substance abuse.
Okay.
So what I wanted to appreciate, and our African Botswana people say, what is the picture? And like I said, no names. What is the pattern of the typical? Are we having for instance, a sleep disorder issue around? What sticks out from your experience and your colleagues as well in the industry?
So the picture ya Botswana says there are mood disorders. The picture ya Botswana says there are anxiety disorders, and it is a spectrum. There are the psychotic disorders. Tse ka Setswana re di bitsang botseno. And it being in the teenage to adulthood age spectrum. Mo baneng le bone, they do have depression, which will be
But now you are talking what age range? So that before teenage?
10 before teenage. 10-year-old, 6-year-olds.
Okay.
And it presents differently in children than in adults. In children, in an adult way, you'd see a sunken mood, a withdrawal. In a child, you are likely to see agitation and aggression and just being horrible. Kante is experiencing this. Grumpy. The adult will withdraw, but the child will be all over the show. So there's a difference in the manifestation of depression in children versus elder. And then in children, because it is at the time of school-going age, we notice a lot of disorders of the autism spectrum.
Okay.
Where there are the various learning disorders, behavioral disorders, socializing disorders that affect children. So, and as they grow older, I don't know if they fall through the cracks, such that as one whose practice attends to teenagers and above, I don't see many of those.
Okay.
Yeah. So, or maybe they go to other...
other
or maybe they continue with the primary practitioners. Drug abuse, drug misuse is rife. For some, they think it's recreational, but then it becomes a habit, becomes habitual, and then it becomes a problem like that.
Drugs, we're talking what? Are we talking my glass of wine per week? We talked about wine. Don't get thirsty, man. There's the wine. There's different types of alcohol. Then there's marijuana. Then there's obviously the hard drugs. You just generalized it, but are we able to say this is what's becoming notorious here in terms of what you guys are dealing with, or increasingly? If you watch the news and you hear, there's like this influx of hard drugs that are hitting the country. Is that something that's, and within what age groups, if so?
Teenagers to middle age. And the person in me, I get a person in me, I get the psychologist in me. The person in me, weed is very common. It is used widely.
Really?
From 10-year-olds.
Really? Sure.
Yeah.
Emma, you can carry on.
Sorry.
Emma.
Yeah. And
now that some of us are becoming grandfathers and what, so that's why.
Then alcohol. For a substance to be said to be a problem, to be abused, there's the frequency and the quantity that a person takes. Then we say this is a problem. But your occasional glass of wine, it is not a problem. Your occasional, somebody's going to kill me, your occasional whiff of Zolo is not a problem. I'm not encouraging
It's not a problem. Occasionally, are you taking weekly, monthly?
Yeah, right. Weekly, occasionally.
Just checking. See, the guys are now attending to this. And the issue here is the addictiveness. Is that where you are?
Because chemically in these substances that say to the body, this is nice.
I need that again. Yeah.
It gives me a high. I'm feeling light. It feels like I have no worries in the world. Who wants to have worries? So people will indulge repeatedly, and then it becomes a habit. And then we get to issues of abuse.
Okay.
Because you even then go beyond the normal use.
I got you.
When your glass of wine does it for you, you are like, this is delicious. Your weed,
I'm watching you very carefully. Now I cannot take a sick.
If it's supposed to be 3 centimeters, but then you make yours 5 centimeters, until you make it 10 centimeters, that is the increase in quantity and frequency as well.
Okay.
With alcohol, our children are drinking bujalwa. Our children are drinking majalwa because I'll have a fancy cabinet there that has my vintage, that has my vintage, whatnot, which I say when my friends come, I'll give them and we enjoy. But our children want to experiment with what we are enjoying.
Because they're at that age, isn't it? Where they're inquisitive. They want to try things. They're growing, so they want to see. There's actually a positivity around that behavior.
The behavior is
interestingly,
good. Interestingly. So when the child becomes inquisitive about tapabotlo ya ga timer, o nna molato gore o le godu simula bogodunyana o se ka bojalo jwa me jwa 1952. But why are you keeping it in your home? I know it is your home, but if you don't want your children to have access to it, but then you won't be able to show off. Lock it in your safe. I think it's pretty, I don't know, when it's there in your cabinet and your friends see that vintage 1952, 1974. So then some parents have said, I'd rather my children drink at home with me. You saw my eyes. Then they are going to be able to drink outside of home. And when you are not there, what do they do? Banadebo Monkani, where it would be your punches that have everything under the sun put in there. And then there's liver toxicity as a result, where there's alcohol poisoning, where people can actually die from that. So these things,
you haven't talked about the last one, the hard drugs.
The hard drugs, there might be a reason why I'm not talking about it. The hard drugs, when we were growing up, Mandrax. Mandrax was what we heard of as a hard drug in
Mandrax.
I've never laid eyes on a Mandrax tablet except when the drugs and narcotics squad puso in Ruta at some place this is era like that. So hard drugs aren't fashionable. There was the introduction of cocaine. crack cocaine, abo go nna le di-variations nyana tse ke sa di itseng, and then abo gote go na le bo methamphetamine, ketamphetamin, tse e leng gore
the famous
katse rra, e leng gore gompieno is affordable because everybody can lay their hands on. I'm saying affordable because anybody can lay their hands on. How do you get the money to support your habit? But those are rife. In my practice, I have chosen not to deal with the disorder of addiction on its own, but I deal with the etiology of addiction, the why of it. The how did you get to this place? If a person is saying, I grew up in a poverty-stricken home and I had to sell weed to be able to give food to my sisters, and I tried it and I got hooked, I go back to how did we get to poverty? How can we get out of poverty? How can we get out of the remembrance that I grew up in this family? Now here you are at 40 years old. Do you still need to be doing weed? That is who I am. I don't deal with the stop now and this is how to, even though I know how
wake
to.
Wake up and
I do not, because addiction is a painful disorder. It is a painful disorder to the person because they end up not being able to do things that they are supposed to do for themselves. When they work is affected. When they get paid, the money goes into this habit and they end up not doing anything for themselves. They become reckless. And the nice thing, I say nice, not nice. The nice thing about substance use is that when you are with your buddies and you are the supplier, the one who's buying, you are big. Ubidua bomren. Ubidua foromani. And who doesn't
the
like
supplier?
When the
distributor or whatever.
Komsasa sambabang.
Okay.
Ubidua bom suppliers are never known. But with us here, if I happen to have my stash, all of you are going to be all over me like the big kahuna keneo. And I like it because I'm big. Who doesn't?
There's a status thing.
It's a status thing. And then you all will always be by my side. Hey, Baba Tona, and knowing that I'm getting this recognition helps me to go on doing that. Is that the best way to get recognition? I'm going to say no. But if that is the easiest way, we like easy things. So that is what happens. I said nice, not meaning the nice thing about it.
But you're saying the hard drugs in this community, in this society, it is you see a lot of that. Like you said, with alcohol, especially for the younger ages.
The part is that, yes, children are supposed to socialize with others. It's part of healthy development. When they are out there, they get to experiment, they get to try out stuff, they see others doing, and they want to partake in that as well. So when we have children going to socialize with others, but do have a word with them to say, your drink will be spiked. Trust nobody. I'm not saying children should be suspicious of everybody, but for your mental health, for your physical health, just if you're going to the toilet, take your cup of Fanta with you to the toilet. Whether the toilet smells, it doesn't matter. Or don't drink it when you come back. Even your friend whom you came with from home, your friend may have been given something by friends to say, Yolera matla. So you leave your drink with your friend, you go to the toilet because you came from home with your friend, you think you trust them, and they may have spiked your drink. So it's horrible.
Yeah, that's really horrible. That's really horrible. Now, in terms of, we just want to get into what can be done. And I'm sure with all your experience and colleagues from the context of the Botswana that you just defined in terms of what's happening around drugs, the types of mental health issues, there are two areas. There's the personal, there's a subscriber here who just wants to know, how do I, preventative, I'm always saying, if I'm okay, some I'm sure by check out, hey, looks like from the definition, hey, well, I have to see the doctor, I have to see it. Yeah. But what would you recommend? Let's start with the person at personal level. What is the best way of establishing a very resilient type self that will not easily fall? I know that they say some people it comes from the DNA. I mean, there are people sometimes who say this in this family, suicides are very normal. You can go back, or this family, they are very depressive. I've got friends who are ever cheerful. I mean, they're annoyingly cheerful. Exactly, So yeah. So how would you talk to our people about just 2 or 3 things that they can it will help them to then we can get into policy level?
Ask me that question again when I go back here to say mental illness is something that is also genetic.
Yeah.
This is why it is said that in the olden age, when a young girl said to Batsadi, they'd ask, what's this family history, health history like? Is there a history of mental disorder? And they'll shy away from depression. It is said that if I, as a parent, have suffered depression, my children are at 50%
chance of getting
error. So it is hereditary, it is genetic. So for some, it's not even who dirahetse singwe. Therefore, it is just as nature had it that I happen to be born into this family. Can you ask me that question again?
Before I go to that question, just to your thing again, or your point again from you talk about mental health on the, I call it below 0, where someone's got depression, anxiety, what. But there's also same thing on the happiness side. In other words, there are people that are happy in their genes. Am I right? I just wanted to balance to say there's that side, but there are people who are just cheery because of genetics. Why? Before again, because now you're exciting other things. Talking about that, because it's so painful when someone is genetically like that. And now we bring in the taboo issue, this famous stigma issue. So I think we'll have done injustice if we don't talk about the people that are not coming out, the executive with a nice suit, with a good speech at a company party, who's actually stressed and is depressive or takes more alcohol than he should, busy breaking about, 16-year-old thing can't do it, and because they can't come to you because they think, no, but I'm a big shot, I'm a big shot, I can't. How do you talk to Botswana? Now it's just an African thing around this issue of taboo. Is it still there?
Stigma, there's this word stigma and there's this word discrimination. My personalized definition of these is that discrimination is something that someone does to me. I then say, according to Thato Molefi dictionary, stigma is that which I bring on myself saying people are going to. When I access services at Lobasa Mental Hospital, how are people going to look at me? Who said people
just packing there and walking in? I'm like, yes, who's watching me?
So I'll go there at 5 o'clock when I know that 4:30. And when they see you, what happens thereafter? Is it going to undepress you? Is it going to unschizophrenia you? No, it will not. So it is us discriminating against ourselves, thinking people are going to say stuff about us. And after they've said stuff about you, then what? So I say to viewers, the same way you rush to a doctor because you kicked the corner of a table with your big toe and the nail has detached from the toe and it's bleeding is painful. Treat mental instability as that. Go for that first aid, your mental health. And when you get out of the doctor's office, ka bandage kana mo monaneng o tsamaya o tlosa ka serete jana, it's go rileng ke ragile tafole. Oh, so why can't it be go rileng nyatle ke tswa go Molefi fela ne ke lla me gompieno ke siame? Oh,
life goes on.
Life goes on. So when we stigmatize against ourselves, we then deprive ourselves these services that are critical, important, vital. So I really urge people to access mental health services. A thoroughly well-trained, well-experienced therapist will, through their experience, you will then say, I should have long done this. The other day, I had a teenager come to my office who did not want to come to my office. So we talked about the birds, we talked about the rains, and then...
You was pushed by the parents or what? You didn't want to come? Or she actually ended up bringing herself, but you could see she'd
suggested by the parents.
She'd rather not be there.
I'd rather not be here. So we talked about this, that, and the other, and I would sneakily weave in things that I needed to hear from this individual, and opening up, talking. A typical psychotherapy session is 50 minutes. I make it an hour, but in my first session, it's not often an hour because people come loaded. Yeah. So it can go into an hour, 30 minutes. So an hour, 30 minutes, I'm wrapping up. How was your session? Oh, it was good. It was good to talk about. It's like, okay. So we finished. As they reached the door, I was like, that's it.
You done it. You done it.
So without even saying when is your next session, because when I say when is your next session, I am forcefully implying that you need to come back. But when a person says, when is my next session, that is me saying, I touched a nerve somewhere and somebody sees that they need to come back. So it is very helpful. It helps you, even with the seemingly mundane things, such as what do I do when I go to present myself at this job for the first time? What should I wear? Should I wear a long dress? Should I wear a short dress? Should I wear a tight dress? Should I wear a red tie? Should I, seemingly silly, mundane things are things that you can talk to with your therapist who will help you walk through it.
But stigmatization and taboo about mental health is still preventing
people
the transformation,
services,
the whole people accessing services, and which can lead to these devastating impacts where someone ends up taking their lives.
There are people who will say, does it work? And I think it's a genuine question. There are people who say, does it work? There are people who say, will they not talk about me in their spaces? And my answer to that is, there are a million and one things that therapists can talk about that do not include you, that do not reflect anything about you. So never fear that you'll be a topic of discussion at any space.
It's a very good question, because it's a very good point, because I wanted to ask this question. Where are the psychologists and the psychiatrists around this whole movement of helping people? Partly why I was very keen that you come, amongst others on the same subject, is to educate and try to get people to know that it's okay to seek help. Also understand even simple definitions. That's why when I was humming on about define it, because people go to school, they Google, so they understand these type of things, that it helps them to know what to do next. Do you think you as an industry are doing enough? And do you have enough resources? I mean, others in other countries, they think really psychotherapy and counseling should just be standard, mainstreamed, anywhere and reachable. But I read somewhere that there is still a shortage in Botswana.
There is a gross shortage in Botswana. You see, with psychology, let me say, there are over 50 branches of psychology. kana phologolo go te motho multifaceted. So psychology also addresses the different facets of motho jalo. You know, there's a child psychologist. There's a clinical psychologist. There's a child clinical psychologist. So o bone gore ke ba bararo doing sort of the same thing but not quite the same thing.
Yes, yeah.
So when we talk of psychologists, there was a boom around 1990, the latter part of the 90s, where government sent many people predominantly to the US to study psychology. And the training in the US is such that with your first degree, you are very wet behind the ears. Then you have to go to your master's degree. Then you can go into your doctoral degree, either a doctor of philosophy in psychology or a doctor of psychology. Now, government had a policy at one time where they said they do not sponsor people for doctorates. And it surprised me because there are other ministries that have doctors in the various
areas,
fields.
correct. Yes.
And ga ke bue ka bongaka jwa motho jwa leruo jwa dijalo jalo, but they have doctorates. So I couldn't understand the rationalizing there. But anyway, so we then also have counselors who, the way I break it down easier for my understanding, is to say a counselor is more like a person who would advise where the psychologist would be looking into diagnosing a mental health issue, a mental illness. So the psychologist would go into therapy, which is kalahi, where counseling is bohakuludi. Bohakuludi ga se kalahi.
That's very important to differentiate.
So it's counseling.
Because I think largely we just mix up those things. It's like I'm going counseling, therapy, whatever it is.
Where therapy is gogoling toaditing we ala.
Okay.
Ka go bua le go thusa go hetola maikutlo le dikakanyo le boisolo.
No, thanks for that. I mean, I think the shortage is not helping.
The shortage is not helping. Not only is it not helping, and because people have noticed the shortage, that they then jump into this niche that can be exploited. And then we do a 3-week course of a counselor. Honestly, painfully so.
Yeah.
Or maybe I'm not being kind. A 1-year course where it's paper-based, book-based, no interaction with clients.
And being tested how you're doing it.
Kana go bua gone rotlhe ra go kgona mme beyond go bua mo go thusang gore motho a thuse ge re dirang. That is a question.
That's the catch. Yeah. Now the question that you were waiting for me to.
Yes, please.
Yes. And I think because of we are just coming to the end, is I think you can combine them. It's really to say, with your many, many years experience, involvement with the psychology board and the council of medical health professionals and all that, there must have been discussions, debates and all that. What do you think at policy level? I mean, I'm saying this because, and I've written a little bit about it as well, how we have uprooted the things that can help our mental health. It's so, I travel quite a lot. When you are in a town like Ottawa in Canada, the way they'll have a bush in the middle of the city where you can just walk and the beds and everything. I don't know why we think we can build cities where people can't feel the nature. You can run in that forest for kilometers and kilometers. And I'm just picking an example, where there are clubs that are functional, that are run by the system and all that. Is there something that government from policy can do? And then you can maybe round up with at individual level? What do you think if the viewers say, what can I do tomorrow? Start doing, because obviously it's not there's no silver bullet that works. Yeah.
I wish there was. Or I'd be
You
out
would have
of
a job.
work. I would be out of work. Where possible. I wish there would be enough, and I don't know what enough is, trained psychologists. Might I say clinical psychologists? I mean, I'm a clinical psychologist. Yeah.
More of you.
More of me. More of us. Le ba bangwe, era. And yes, when I label health, when I label counseling, psychology, but let me talk about clinical era in industrial, such that in every space, there are clinical psychologists there. Mudikweling, tsohle, nursery school, primary schools, junior secondary, all those schools, private, government schools, hospitals, clinics, all these entities ought to have a psychologist.
And our clinics don't have psychologists.
Our clinics do not have psychologists. Our hospitals...
The Good Hope Hospital there, chances I don't have a psychologist in there.
No chances. And then we have our main hospital, Mogaborone Princess Marina Hospital, which has on a daily an influx of more than 1,000 patients coming for services mo Marina. Honale inpatients.
Inpatient and outpatient. Yeah, you talk about outpatients, like people who come in, yeah.
Yes. So even the inpatients who's in hospital for 5 days, it would be great if a psychologist could go and have a chat with them.
That's right.
2-3 sessions.
That's right.
But psychologists there are inundated by the influx of the outpatient, such that they may not even have proper enough time to go and see the inpatients. Doctors would then refer to the psychology unit, who the patients would then come as outpatients once discharged. But while discharged, it's very rare is too strong. It's not often that psychologists are able to attend to even those that have been referred while in hospital because of the influx of outpatient, and also those that are from within the hospital. So we need psychologists everywhere. Why am I saying clinical specifically? Because where there's a human being, you can expect that there will be some form of depression. There'll be some form of
mental
stress.
challenge.
There'll be a mental challenge somewhere. And the clinical psychologist who deals with mental disorders is the clinician, the professional to deal with these.
I got you.
And yes, in workplaces, we have the industrial psychologists that help, industrial organizational psychologists that help with even seeing to work spaces, which seeing to workloads, which see to person job fit. Good.
Got you.
But then this person, the worker, will have a depressive episode, will have generalized anxiety, would have post-traumatic stress disorder, which are not quite attended to by the IO psychologist.
The industrial psychologist. It's not that's not his or her space.
I'm sure, but not in depth like the clinical. This is why I say the clinical.
It's quite, yeah.
The health psychologist will be there with a patient or satswang honale diagnosis, let's say diabetes mellitus, sukiri. O tla ba mo ruta gore o tshwanetse gore o je yana o sa re yana. Mme go na le component eo ya gore my life is changing. Ga ke sa tlhole ke tla kgona gore ke nwe dibiri ka ga ke batlang ka teng, ke a go itisa jang gore ke kgaole maitiso. Ga ke kgaola maitiso ke joa ke bodutu, depression ya tsena. Clinical psychologist wa tla ka ko.
Okay. So, but you talked about mainly about, the capacity to handle mental health at a country level. Is there, I don't know, maybe I'm just shooting in the dark here. Is there anything from a holistic, I don't know if there are policies around there in terms of general holistic well-being of people that will touch on societal values and things like that? Or that's just too fairy tale or too much in the air to actually touch?
Ke a go raya ke re ga ke ise rra. Ke se ke ka timetsa lehatshe le Botswana. I know that many organizations are interested in the mental wellness of the workers. You know, even in schools, there's the guidance and counseling units in schools where children who have issues go to these teachers to be attended to. I also say who attends to the staff, because it's often for the children who attends to the staff as well. So ho teng in small doses ga go tshwane. It would be great if it was a policy that could be well implemented, well staffed, and see to it that indeed people are taken care of.
I mean, just to give you an example, as we've discussed, I usually come in from the positive psychology part, because I think if you improve well-being and happiness of people, then there's a lesser chance of people dropping into mental illness. So through this gentleman from University of Penn, collaborated, talked to the ministry about introducing what they call positive education. This is education which is infused with grit, with resilience, with finding that the kids do things that align to their talents so that they have a high chance of. So this has been done in lots of countries now, in this positive education thing. And, you know, we tried to approach the ministry a few years ago, and they said, we've got counselors, we've got career. And I said, no, this is beyond. But anyway, we hit a block. And but this is the type of thing, because these days I'm like, if you don't train people on how to build relationships at primary school, then they suffer later on. So that's why the schools we have to start young in terms of building these things, which are now becoming essentialities of survival, because we don't want people just to survive. We want them to flourish.
We could even start at home. Because by the time a child gets to nursery school, I took mine to nursery school when they were 3, they have an identity about them already. But if they started at home, home psychologist, starting there where the child immediately learns how to share, where the child, where the family learns how to talk peacefully with one another, others. How to critique and not criticize, how to, all those positivities would help in the long run to have a society that is bubbly. Maybe a state of euphoria is unrealistic, but if one can think it, why can't
it happen? Absolutely. Absolutely.
You know, the other day, I dropped my children off at school in the mornings, and they are not too fast getting ready. So I'll say to them, guys, if we don't get ready in good time, we're going to be late, we're going to be stuck in traffic, and then when you're late, I get stressed. So guys, so yesterday my children were very slow in getting ready. And I said, today, I'm not saying anything. We talked about that car, bona plate number, eleke 44 and eleke 114, bona diaswan, bona APG, bona P. We didn't talk about traffic and that being late and how it means what to yada, yada, yada. I had a great day. We are a little late. I hammered it. I hope Mapodisi ga lebelle this podcast. But I said, guys, no scolding. And I was okay. I had an okay morning. But the mornings where I'm fretting, so just choosing to say, I will not dwell on the unpleasant things of life. There's a Baha'i prayer that has this line, I will not dwell on the unpleasant things of life. So with that, when you keep remembering that, you're like, should I fret? Do I have to honk? Many times when I'm in traffic and a person honks, I'm like, kidding. There are times when I honk back when it's unnecessary, but then sometimes getting like this morning, there were 3 cars in front of me. The one behind me, o batla go tsamaya.
Wa modia.
O diwa ke batho ba le bararo ga se nna, ga se nna. And I left it at that. So being able to self-regulate, self-control, and say, what good is this to me, will really help us reduce these flare-ups of emotions that turn negative.
And they're so daily. I mean, like you said, it starts at the traffic and commuting in the morning. You go to work, you fight with your boss. So that's where the very unhealthy thing carries on for the rest of the day. Yeah. Emma, no, Mary, re thatile. Morolong. I really appreciate it. Just we usually end up on anything that has really impacted on your life, whether a book or anything that from your profession, the young people or even older people can take away. Is there anything that you'd like to share that you think, if they listen to that podcast or read that book, that will really...
The nature of my profession is that I don't disclose people's names. It's called confidentiality. My name's ke Thato Beverly C. Molefi. C yo ke leina la Sotho, bitso la ka Sotho ke Cheshe.
Bitso la ka. Manu. King
Cheshe.
Cheshe is in flower. Oh, okay. I never knew that.
Hey.
Emma. Hey, beautiful.
Thank you. So, ke CEO o emetse confidentiality. So, ke go doja ka style ke gore a book that I read and has had a lasting impact mo go nna ke 5 Languages of Love.
5 Languages of Love.
Yes. Is it 5 Languages of Love?
It
or
is
languages?
5 by Gary, is it?
Gary Chapman.
Yeah, Gary Chapman, that's correct. Yes.
And I disclosed the name.
I let you, sorry.
After that rhetoric era. And in it, the reason it stuck for so long with me is that it sort of goes with the golden rule, do unto others as you wish done unto you. Era. And as a follower of the Baha'i faith, one of the counsels is prefer your brother over yourself.
Okay.
So in this book, I was just seeing that direla motho o mongwe ka ha o batlang go direlwa ka teng. And when you do that, go nna monate ke batla go direlwa sentle. So ke tla direla yo mongwe sentle. And as one enjoys this sentleness of it, it cuts down on the necessity of ill feelings, of feeling the bile churning in you. So it has helped me in my personal life, even in my professional life, where I feel I'm bending back too much.
Yes.
It is in the best interest of the client, and luckily it has always worked well. Like is good any backfiring from that. So that is my
your book. No, that's a very powerful. I happen to have also, it's actually here in the house, the 5 Love Languages. And like you said, it's got to do with serving and doing unto others as you do unto yourself. Especially, I like the word serving. Because it is really this love language is this person likes touching.
Yes.
So I will invest in touch, even if it's not, not me. Yes. No, thanks so much. Thanks so much, Cheshe. Now that I found a new name this afternoon. Thank you. I really appreciate it.
Thank you.
I trust that you found that very powerful coming from our clinical psychologist. As we've promised, we're going to bring you high-impact podcasts that hopefully can make an impact in your life here in Botswana and Africa in general. So thanks very much, and please do the needies. Let's share this with other people. So if you subscribe, it helps us to bring even more and more experts like Cheshe. Thank you very much. Cool.
You heard it. Thank you.
Cheers, man.
Thank you for joining us on this journey of growth and discovery. We hope today's episode has inspired you to dig deeper and rise higher in your personal and professional life. Keep tuning into the Growth Well podcast for more stories, insights, and strategies to help Africa grow and thrive. Until next time, stay curious, stay inspired, and keep growing. Don't forget to like, subscribe, and turn on the notification bell.